Even in a city like Glendale, which is dense with medical facilities and advanced care, a critical question remains. What barriers still keep residents from accessing timely and adequate care? While Glendale is considered a well-resourced city, access is not always equal. To understand what life in Glendale really looks like, we spoke to Tamara, a longtime resident. After meeting Tamara at a local park, one thing became clear. Glendale is a diverse community that takes pride in caring for its residents.
Glendale Adventist, Glendale Memorial, best hospitals, best doctors, the Armenian, Russian, Persian, any languages, like international, they're one family.
Glendale is also home to top-tier hospitals and a multilingual healthcare system that reflects its diverse population. But Glendale does still have its barriers to accessibility, and the harsh reality is that disparities do still exist.
Before, we don't see any homeless in Glendale, but right now we have one. But they're making a lot of Section 8 program for them. I'm so happy for this. They're thinking about homeless. Even homeless, anything happen here, right away, emergency is coming, take care of them in the hospital. And they are receiving food stamp, money. Yeah, they're helping them.
Next, we spoke to Dr. Agazarian, a family medicine physician at Advent Health, about the patients in his practice and the barriers they have to receiving care.
A limitation I face in helping my patients reach their optimal health outcome, I think I kind of touched on this, is getting the right medication approved. A lot of first-line medication for whatever, it being like diabetes, which is a kind of a bread and butter for a lot of family medicine or primary care physicians. A lot of these medications aren't being approved by the insurances, and we kind of have to reroute to see what ways we can try to get a medication approved. This is a limitation because it's a medication that they were previously once on that was beneficial, and now they kind of have to circumvent around and try to get it from a compound pharmacy or maybe like a beauty spa or something like that.
We also asked Dr. Agazarian about what community health resources are available for patients.
Besides free clinic for our patients, we also offer like a health fair that happens, I believe, is a couple times a year, hosted by Adventist Health Glendale, and it's kind of the same premise where they can come and get labs and whatever medical questions they have, we'd be happy to answer. But a lot of patients, actually, there are barriers to being seen at a clinic, and it might be overwhelming. Being seen at a health fair, just letting a provider know what they're experiencing we've noticed it kind of opens the door and allows them to continue medical care. And we actually do help them as well. Kind of ties into your last question. For patients that don't have insurance, we do try to help them, if they don't have insurance, kind of get them kind of in the network to see what we can do. If they can apply for Medi-Cal or Medicare, and kind of see how we can assist them.
In a community as diverse as Glendale, communication isn't always a barrier. It's often a skill providers learn over time to better connect with their patients. We next spoke to Aaron Tianco, a doctor of physical therapy at Glendale Adventist.
It doesn't really become more of a barrier, but more of a skill set that you have to learn. You also pick up a lot of the language as you work with this community more. Like, I've learned the most Armenian and Spanish and practiced that the most since I've worked here at Glendale. And I think it kind of helps the community know that you're actually trying to understand them on their level.
But even when communication improves, new challenges emerge, not just in conversation, but in coordination. For many patients, especially older adults, the issue isn't distance, it's navigating the technology required to access care.
But the major barrier for navigation is the technological aspect of that, like having to utilize their phone or their apps to be able to get to the clinic. Some of the ways that we've helped kind of mitigate that is having them call their insurance and having them setting up a ride-share program.
In the city of Glendale, community support often extends beyond the clinic into the spaces where patients live, move, and heal.
One of those community programs. We have an athletic training program where we transition patients away from physical therapy to athletic training with trained athletic trainers, so that's one aspect. But in the community, there's local YMCAs that we recommended patients to. I can't speak on any of the parks that we have if they have any exercise equipment for the population, but the YMCA tends to be where we'll refer patients to, or as local gyms that are out of pocket.
We next set out to explore nutritious food options in Glendale. We sought to understand, is healthy food accessible to all community members, or is Glendale considered a food desert?
Nutrition is something that I've noticed is impacted by socioeconomic status as well. Patients from lower socioeconomic status, it's easier and cheaper to get fast food. It's actually cheaper to get a McDonald's burger versus cooking your own meal. But I would say there are good health options in Glendale. Are they affordable? I would argue they are not affordable.
In the foothills of Glendale, the Montrose Farmers Market is a local spot where residents can buy fresh produce and homemade goods directly from local growers. We visited the market to better understand what fresh, nutritious options look like in practice and at what cost. For example, a small container of fruit costs about $7 and a loaf of bread about $8. For many families, especially those already facing economic challenges, these prices make regular access to healthy food difficult, which reflects a broader issue in public health. Access isn't just about availability, it's also about cost. The market, however, does accept EBT SNAP tokens, increasing access to fresh foods in the community. Looking at this, the farmers market helps show both sides of food access in Glendale. There are fresh, high-quality options available, but not everyone may be able to afford them regularly. To improve wellness, we must look beyond medical care. It requires understanding the lived experience of every resident, from the senior navigating a kiosk to the family struggling with housing costs. What does good healthcare access look like? It looks like a community where everyone, regardless of age or language, feels supported and seen.